I think first of all that it's important to understand who is using your service. We found a number of instances where insufficient records were being kept, so to be able to make a decision, because there are difficult times ahead, local government will need to make a decision about the services it retains, it changes and so on, but who is using them? And particularly since we're looking to the next 10, 20 years, when a quarter of the population of Wales will be aged over 65. It's difficult to just categorise services and saying, these are older people's services. Older people will be using all services, but in what proportion? Because that is what the local authorities need to do in making a judgment over what to do next. Secondly, I think it's important that local authorities don't fall into the trap of assuming that older people's services are those to do with the health, social care area. They are to do, as I said, with all services, and particularly services which are designed for the community as a whole will prevent older people falling into a problem area because they are unable to access other services, or they may have difficulty maintaining the kind of social contact that will enable them to avoid needing more intensive work. The preventative services. The government has really stressed this in its strategy for older people, and it's important that is followed through by local authorities. And then lastly, I think I'd say, if you're going to make a decision in future about the services that you provide, understand what other services exist but in your area, provided by other public bodies and provided by voluntary bodies. Because a judgment has to be made about the totality of services in Wales designed to help older people continue to live and work, because many local older people still need to work, want to work, can contribute to the local economy. Older people are not just dependents. They are part of our community. They are part of our society and should be treated as such.